Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health and take you to the brighter side of the health. In today's video, I'm going to answer one of the commonest questions that people often ask me when they are consulting us for Bell's palsy. That is, why do I feel extra movements or some kind of extra contraction twitching around my eyes or else around my mouth or else around the neck region whenever I do facial movements like closure of eyes or trying to frown, trying to smile, speak, etc. Well, this is typical sign of synkinesis. Now, the reason why you experience some extra contractions are due to two important reasons. Number one is the lack of complete recovery of that particular muscle. So for example, your facial nerve is a nerve which starts from your middle part of the ear, and then when it comes towards here, it branches out in 5 branches like this. Now if you see, the longest branches are some branch which supplies to your eyelid area and which supplies to your oral area. Mostly in my practice I have observed that orbicularis oculi, which is your eyelid muscle, and orbicularis oris, which is your mouth muscle, which is responsible for your pouting action, is weak or else takes longer time to recover compared to other muscles. Before these two muscles, frontalis is also one muscle which takes a little longer time to recover, and the next muscle which usually patients see delay in improvement or else in movement is the depressor muscle, or is the muscle which is responsible for the downward action of the face. Now, whenever these muscles have not recovered completely or else are in the process of recovery, what is happening is, whenever you are doing your day-to-day things with your face, like blinking, you can't avoid blinking, right? Like speaking, you can't avoid speaking. Like chewing or making facial expression, all of them, right? So for example, whenever I am trying to say words like oo, p, b, m, where I need to use my oris muscle, since this side is weak, okay, what is happening is, this side, the weaker side, is trying to match from this side, and since when this is not able to do it, it is trying to take help from the surrounding muscle. Now when this happens over a period of time, it becomes hardwired. Your brain has learned this new pattern of movement where whenever I am going to move this side, it is going to take help from the muscles around the eyes. Now this is not something newly developed, this is a common pattern that we usually have since our birth. For example, whenever I smile wide, you will see some crow lines will come around the eyes and my eyes will become small. Even whenever I do, there is some amount of pressure that is always there, but this gets amplified during synkinesis, and due to which whenever you are trying to do an action around the oris muscle, that's when these muscles starts contracting and you feel extra contraction around the eyelids. This is what is synkinesis. Similarly, if your eye closure has not developed well, mostly this happens due to weakness of your orbicularis oculi muscle as well as the tightness of the orbicularis oculi muscle. When that is the case, your eyelid closure will not happen. This lower eyelid has to put little more extra effort to move up, and that's when it will try to take help from this muscle, and you will see and observe synkinesis or else extra contraction happening here. Similarly, if your frowning muscle or else your eyebrow raise muscle is weak, that's when it will try to take help from your platysma, from your eyelid, and from your oris muscle as well. And that's when you will observe synkinesis. And at the same time, whenever you are trying to do this movement, since this is not happening, you will see a lot of platysma contraction but in a wrong direction, which is synkinesis. That's why it's important to know that your lack of muscle strength, at the same time a new learned pattern combined, leads to experience of synkinesis. So in order to solve the problem of synkinesis, what we need to do, first thing, we need to learn to isolate these muscles, and that's what is neuromuscular re-education all about. training the muscles to contract in isolation. Second thing, relaxing these muscles. Whenever these muscles are overworking continuously, they get tired and they get into spasm or cramps that we usually experience in our leg and back also when we overwork or else we are tired. That means the other side or else the weaker side of the face needs more constant relaxation practices over contraction practices. Whereas people try to do absolutely opposite of that. They try to contract these muscles way more and more and more, and they keep on getting tired and tired and tired, and then they end up increasing their synkinesis level. And that's why it is important that relaxation is the key for better improvement in synkinesis. I've also observed people who speak slow, who speak in control, are able to reduce their synkinesis level compared to the people who try to speak very fast. Hence, it's important that here we are trying to build balance. Synkinesis is a mechanical problem which needs to be improved with balance. Hence, muscle relaxation, regular stretching of the facial muscles, and at the same time, teaching the facial muscle to move in the right pattern is the key to recovery for synkinesis. And that's how synkinesis is managed. I hope this concept fits in your mind so that whenever you are doing your exercises, you mindfully try to do exercise and just don't do random exercise, anything that you see on YouTube, Instagram, etc. Even facial yoga. A lot of people ask, can I do facial yoga for my synkinesis? Answer is absolutely no. The problem is not with facial yoga. All the exercises are not suitable and right for you. Hence, it's important that you should take help of an expert or as a person who understands your face well, who understands the anatomy of the facial muscle well, and then only gradually do exercise. And also remember, synkinesis is not something that will go away in 2 or 3 months. It's a time consuming process. It might take more than 1 year to gradually show results. Sometimes if the damage to the nerve is more, at that time you need to do combination of Botox as well as exercise and even sometimes surgery, which is rarely done in India. But yes, in abroad countries like US, there are a lot of advanced surgery which are already happening and is helpful. So wherever you are, seek help. Try to do a little bit more research and then reach out to a professional who understands about facial paralysis, who understands about facial anatomy, and then work on your therapy. On that note, I'll end this video here and I'll see you in another video. Thank you.